Temporarily closed. That's the status of the special care nursery at Methodist West Hospital in West Des Moines. It's an announcement that came as a shock to one Unity Point employee who didn't want to be identified. But this now means newborns who require specialized care after birth have to be moved downtown. Local 5's Khalil Maycock reached out to the hospital to find out why they closed and how many people this is going to impact. Khalil, what'd you find out?
Good morning, Sabrina. So Unity Point says the temporary closure has to deal with staffing, but the employee who sent me the tip says it's alarming the staffing is so short that a closure was the outcome. In this email that a tipster sent to Local 5, a person tells me Methodist West has had to close their special care nursery due to staffing issues. This internal document sent to Unity Point staff, which was shared with Local 5, explains newborns requiring the SCN will be transferred downtown for appropriate care. Methodist West doesn't offer a neonatal intensive care unit. Instead, they have a special care nursery. It's a nursery with a specialized team for babies born at or after 32 weeks. They weigh more than 3.3 pounds and may have some health problems, but not so serious that they need a higher level of care. And the NICU is at the downtown location. Now, this internal document is called an all-team member update. The closure of the SCN isn't the only change outlined. They also say we will limit scheduling of procedures at Methodist West due to ongoing staffing needs. The concerned employee says no explanation was given as to why staffing is so low. Example, COVID infections versus staff quitting over the vaccine mandate. Now, the memo does highlight the importance of PPE and says during the month of September, there was an increase in team members off work due to COVID illness or exposure. And I reached out to Unity Point to confirm the closure. They responded saying in part, the care and safety of our patients and team members remains our highest priority as we work to maintain and deploy the staff to meet this increased patient demand. Special care nursery is temporarily closed. Newborns requiring that nursery will be transferred downtown for appropriate care. Now, when I asked for further clarification why they were experiencing staffing shortages and how many patients this would impact, this was their follow-up response. The SCN cares for 5 babies a month that's staffed with a 1-to-1 nursing coverage because that may be required for the baby's diagnosis. And in response to staffing, Unity Point says staffing remains an important priority. Hospitals are treating more and more sick patients while trying to retain nurses and other health care providers during another wave of COVID-19. And to solve the problem, they are going to implement retention bonuses for certain employees, implement shift differentials for hard-to-fill shifts, and expand referral bonuses and a nurse float pool. Now, it's important to put this into perspective. There are staffing shortages and nursing shortages across the country right now, and maternity wards in small towns across the state are closing because we are in a global pandemic, and there are a lot of factors that are at play.